Hi there. Just wanted to have a segment on what happens to an athlete's heart. So, one of the things that we know is that if you're an endurance athlete, and what I mean by that, typically it would be someone that is probably exercising 10 to 20 hours a week with a fairly high level, is you do get inherent changes in the heart that can cause their own problems. And this is why, athletes sometimes do get implantable defibrillators, sometimes they do have sudden cardiac death during an event. And there are probably two ways to think about it. One is that you actually have a cardiac issue that you weren't aware of, and you became an athlete and that was unmasked. So these can be where your coronary arteries may not have formed correctly, or you've got a genetic thickening of the heart muscle. The other way to think about it is what all of this endurance athleticism, where your heart is performing at a high level for many, many hours a week, does to a heart. And it can do a number of things. It can remodel the heart. The heart muscle becomes thicker. The heart muscle, the chamber dilates because it's asked to do more. This and then can create its own problems in terms of stiffening of the heart. You can get rhythm disorders. You can get a dilatation of certain other chambers, like the atria, for example, or the big pipe that comes out of the heart, the thoracic aorta. I've got a few clients who are high-level cyclists that have got a dilated aorta, and if that aorta dilates too much, it can rupture, causing sudden death. The rhythm disorders are fairly common. Some of them are potentially nasty rhythm disorders, what we call ventricular tachycardias. And so, I say to clients, the reason we do stress tests, the stress test is not a great it's not the best test for coronary artery disease. I mean, a CT scan would be better, but it tells us how fit someone is. It tells us whether they have any rhythm problems. Yes, occasional pick up coronary artery disease, and it's just it'll tell us what their blood pressure response to exercise is. If your blood pressure goes through the roof with exercise, perhaps you shouldn't exercise so hard. And it is a mark of longevity. So it's a great overall test to do. So getting back to the athlete, we want to see athletes. We do see athletes because we want to see if they've got any athlete-induced cardiac abnormalities. And the message is not don't do your 10 to 20 to 30 hours of high volume exercise if you're really into it. The message would be get yourself checked out. And not infrequently do we see athletes who are superbly fit with terrible coronary artery disease, which then needs managing as well. So just for those that don't know, it's just an interesting point. Being a high volume endurance athlete alone can create its own problems, which can be managed, can be looked for, and should be monitored. Trust you well, and look forward to seeing you soon.